All right, let's be honest. The COVID-19 pandemic has affected all of us over the globe. It has affected how we go about our daily lives and how we do things. But as life goes on with this COVID-19 pandemic, we must also understand that illnesses and certain diseases are also not taking a break. In this episode, I'll be talking about 10 different health emergencies that you may encounter even during this lockdown period. Now, my number 10 is heart attack. And guys, whether you see something coming in number 10 or number 1, it doesn't matter. All that matters is the things that might happen during this lockdown period at home, wherever you may be. So if you have an underlying heart condition, say you have hypertension, or you have a chronic illness like diabetes, or you are elderly, or you are obese, and if you are smoking too, during this period, you are at high risk of developing a heart attack. And I want to believe that if you are predisposed to having a heart attack, you should have certain medications with you at home. And if you don't, you must have a hospital on a speed dial. So how do you know you're going to have a heart attack? Number 1, you have a tight chest pain that moves towards your shoulders and also upward towards your jaw. You might have sweaty palms. You might feel dizzy and, easily fatigued. That should prompt. And if you are within the range, you are a smoker, you are hypertensive, you have diabetes, you are obese, and you have these symptoms happening at a point in time, do not panic. Just dial, I think it is 767, Abi? Yeah, 767. So just dial that number and or get to a hospital close to you. Use Google. Yeah. All right, so at number 9, I will be talking about asthma. Now, people living with this chronic condition, when they are exposed to certain irritants such as dust, smoke, old books, some certain drugs. Yes, some certain drugs actually cause asthma. Some of you don't know. Or maybe as a result of exercise, they may begin to have difficulty breathing, such as, they have symptoms like chest pain, wheezing, and at times they could even have cough. But the most important thing is, if you are living with asthma, you should have certain medications by now. For example, you should have your Ventolin or salbutamol inhaler or oral tablets. You should have your steroid medications, or better still, if you have the money in the world, just buy a nebulizer. It's not expensive now. All right, at number 8, I'm talking about people living with sickle cell disease. Now, this is another class of people who are prone to having crisis at any point in time, ranging from vaso-occlusive crisis to anemic crisis to sequestration crisis, anything. It could just happen. So people in living with this condition, you must understand that this is the period for you to rest, eat properly, and stay hydrated. Do not stress yourself during this lockdown period so that you do not put yourself at risk of developing or having any crisis. All right, so at number 7, I'm going to be talking about labor. And somebody will be saying that, Dr. Wale, are you talking of hard work and hard labor? No, I'm not talking about that. I'm talking about midnight baby issues. Now, COVID-19 is not stopping any babies from dropping. That baby that your pregnant wife has been carrying for the past 9 months will soon drop. So as a result of that, you must ensure that you have a hospital close to you. I want to believe that if you are pregnant and you are due to have a baby, by now you should have a hospital where you have registered for your antenatal care. So you must have them on your speed dial, that should anything arise, they should come and carry you. Or if you do not have access to that, make sure that there is a skilled person that is available to take care of your baby during this time. Make sure that their phone batteries are well charged. All right, so the next one that I want to talk about is, we're at what now? Number 7, Abby? Yeah. The next one I want to talk about is burns. And this can happen at home. Now, these are accidental injuries that can happen as a result of exposure to, high energy impacts, such as chemical, gas, heat, liquid, hot liquids and all those things like that. So please, I take God beg you, at home, please make sure that you check your gas cylinders and make sure that there are no leaks. Make sure that kerosene and petrol are well kept and stored. Make sure that your children keep all these things, kerosene, diesel, lighter, matches, keep them out of the reach of children, because anything can happen. Your children are actually desperate to do James Bond during this season. So please make sure that you stay safe, protect yourself. Okay, we are number 5. At number 5, I'm also talking about home accident, another type of home accident that could occur. Fractures, everyone falling down, you are in the bedroom, you fall down, children running, colliding with each other. It is very, very possible for you or your family or a family member to have a fracture. So one thing I would suggest that you should have at home is a crepe bandage. Now, I will not be able to tell you how to immobilize a joint right now. I think I'll be doing that in the next video. If you want me to do that, then click on the like button and subscribe very well. So fractures are likely to occur during this time, so please make sure that you are careful enough to observe your words. Your children as well as yourself, please do not play too hard. Don't fracture anything. Even the things below the waist can fracture. I'm speaking to the men, so be careful. All right, so at number 4, we don't read number 4 now. Anyway, at number 4, I'm talking about skin cuts. Skin cuts or lacerations can occur at home, and it happens where sharp objects do exist. For example, in the kitchen, knives, sharps. It could also happen anywhere in the home. Glass can break somewhere or so. So please make sure that you are very observant to sharp objects. Keep sharp objects properly at home, especially the knives. Make sure that they are well kept at home. And also for glasses, make sure that you handle them with care. Please do not give glasses to children during this time, because they might be careless with it and they might break it. So please be careful with that. All right, at number 3, see, this number 3, it happens to every one of us. And what I'm talking about is food poisoning. Yeah, everybody go chop. I'm sure as you're watching this video, you're probably eating something. And there's a high likeliness, if you don't want the thing to purge you, make sure you subscribe. I hope you have subscribed. Anyway, when we are talking about food poisoning can deal with food contamination. That's maybe the food was not well processed or the food was stale. I know some of you that can eat food that has been in the fridge for 6 months, 1 year. I know some of you are watching this video right now. So please make sure that you are very, very careful. And should something like that happen, you might have symptoms like abdominal pain. You might have some symptoms like cramps, stooling, vomiting. Please make sure that you have some emergency medications at home. Number 1, you can have Imodium. Imodium tablets are actually quite safe for you to have at home, and you can use that. If it's for your kids, make sure you have ORS and zinc at home, zinc tablets. Please make sure you have all of that at home, so that should anything happen, you will be safe and you won't purge all your liquids out. Okay, number two. This actually occurs mostly in children. Foreign objects. I know a lot of you have been angry that your children are at home at this time, because many of you have already planned so many things that you want to do to each other, especially for, but be that as it may, the children are at home, and because of this, you have to pay extra attention to your children at home. When I talk about foreign objects are objects that can easily lodge into the orifices or the spaces in the body. For example, the nose, the mouth. You see that bead that your wife has at home or your girlfriend is carrying? Your cousin can pick it up and put it inside his nose. Children are very handy, and they want to swallow or anything that they have, they want to put it somewhere inside their body. So please make sure that you are very conscious about this, and try as much as possible to avoid foreign objects in the ears of your children, because this actually occurs in children who are about within 1 to 5 years of age. So please make sure you watch out for that. Please, how many times have I said please now? I think I've said it 10 times. All right, so the chief daddy of all the health emergencies that I want to talk about today is, I think we all know it already, malaria. Malaria is the king of tropical diseases. And yes, there is a high likeliness that you think you have COVID-19, whereas it's not COVID-19, it's just malaria slapping you really hard. So you need to make sure that you get yourself tested. If you know you are having symptoms like fever, body weakness, headaches, it's not COVID-19, my brother. Stop prank calling the NCDC number like some people that I know. Rather, go to the hospital and get yourself checked. Just a simple malaria test will let you know if you are fine. Do the test and take drugs. Do not overdose on chloroquine. Please make sure you don't do that, especially when you do not have a test to judge that you have malaria. So I think that's the end of the video. I don't know, is there any other thing that I missed? If you think I missed something, please say it in the comments below. If you think there is any other health emergency that could occur during this time, during this lockdown period, make sure you like, share and subscribe to this channel, because I don't know what's, please guys, I beg. Cheers guys, and have a good one. Peace.